Welcome back to Super Doc Stories. I'm Dr. Marissa Caudill, and it is my pleasure today to have Dr. Mari Mitrani with us. She is, unlike the clinicians that we've interviewed, a physician scientist trained in Ecuador and an expert in stem cells and regenerative medicine. And we really are in for a treat because this is someone who has done things that I don't know many physicians who have done these things. She's been involved in multiple biotech companies, including some that have gone public. And so she's really got that business side of things to talk about. And she's very passionate about her work. So welcome, Dr. Mitrani.
Thank you so much, Marissa. Thank you for having me and for the Super Doc Stories team.
Yeah, it's great to have you. So let's talk about this work that you said you're so passionate about. It's
Mhm.
something that I know about a little bit, but not really. So, what is regenerative medicine right now in America? Like, what is it looking like? It seems like it's a pretty exciting time with lots happening, but yet it's still not super mainstream. So, can you tell us more about this and how it works?
Absolutely. So, regenerative medicine is that field of medicine that when I went to med school, it did not exist. Right. We learned a little bit about stem cells after you have like a bone derived cancer and you have to like obliterate everything and then just repopulate with stem cells. That's like the only thing approved. So, 20 years ago, I started understanding what stem cell therapeutic can look like, and it was super excited by then. Today, it's still very exciting. We're still calling it the future of medicine for a good
Hmm.
reason. But it is the field of medicine that regenerates cells, organs, and tissues in whatever capacity that means. It used to be only specifically for cell derived and genetic derived therapeutics. I've seen lately that they've added the most common hot word right now, the peptide side. Um, Lots to talk about that, but I'm going to focus on my specialty, which is the stem cells. I feel that you can use your own cells, right, which is called autologous stem cells, or donated cells. Those are the allogeneic kind of stem cells. And now the future looks like not only the cells, but the secretions of those cells. What is a cell's message? And we use those messengers as the therapeutic proposal or the diagnostic proposal as well. So, regenerative medicine is really this new evolving field that I've been so lucky to be almost next year is going to be 20 years. So, it's really, I've been at the heart of it. As I was saying, there was no let me show you, let me hold your hand. Like if I'm a pediatrician, right? You have a whole schedule because there've been a century of physicians that have trained other physicians of how to do this. For me, it was more like, how to get into this? And for my brain, how do we do it at the highest level of a scientific, with regulatory compliance?
Hmm. Yeah, so I guess my background, as I told you, even though this is totally weird, my path was not at all linear. I am an MD PhD as well, but I'm a child psychiatrist. And my PhD was in tumor immunology. So, how did that relate to becoming a child psychiatrist? Who knows? Your guess is as good as mine. But when I hear about stem cells, when I think about this stuff, it raises a lot of questions for me about um, is this safe? Like, and how will my body react to
Mhm.
allogeneic cells or bits of cells, exosomes being injected into it? So, how much data is there? Like, this has been around for a long time. Obviously, it's not brand new. Um, what are the concerns that you have, and what do you think is reasonable for what's happening right now? Because you told me I didn't know this either that in Florida it was just green lighted that stem cells can be injected into humans, right? That it's legal there now.
Yes. Yes,
So
it is legal.
tell me about
Uh,
that. Like, how does that work? Tell us a little bit about where do the stem cells come from that are commonly used? Are they
yeah.
just used for like, I- you know, is it just like inject me with stem cells and make me look and feel younger, or is it like a specific medical condition that it would be used for this purpose?
Yeah, so the field of stem cells, like just saying the word stem cells, I always do this analogy. Is like, let's talk about cars. Like, great. W- What cars? Electric vehicles, regular vehicles? Are we talking about Maserati, Lamborghini, or are we talking about Fiat and Civic, Honda? Like, uh, do we talk about cars that are for families, or so? This is how many
Mm,
fields stem cells are and compile, really. So, as I said, you can retrieve stem cells from the patient's own body, which are autologous, which are the exact same cells that are laying in your body, and extract them, purify them, and re-inject them in yourself. Very, very common, very legal to do for many years, right? Many different protocols of how to use those, and different tissues that you can procure those from. Now, allogeneic wise, we found throughout this is a field that is more than 40 years in the making, right? Still a baby field compared to any other bigger field in medicine, but a lot of data, and every year compiling more and more data. So we found that the placental derived or perinatal derived tissue is one of the most noble tissues for donation because it
Mm.
doesn't, and we call it immunoprivilege is the word that we've chosen scientifically, and my scientists are going to say, but that doesn't mean anything. But the field has like adopted that term because it's very easy to explain. Why is it
Mhm.
immunoprivilege? So if you think about the placenta, the perinatal tissue is the tissue that covers the baby. It is not mom, it's not baby, because the baby, which is a complete different universe, set of genetic, is not rejected in those 9 months. Neither the
Right.
mom rejects the baby or the baby rejects the mom, right? It is that shield tissue for protection that makes the perfect tissue for donation. So FDA and AATB, the American Association of Tissue Bank, have very clear rules of how to donate that tissue, which is great because the same way that you go donate blood or donate your organs, they're very strict, clear, protocols of what you have to do and be if you want to be a donor. So, with that said, you can always donate that tissue and somebody can procure if you follow all those steps. So, from that side, we are covered by regulatory that knows exactly. So, where do we collect this tissue? This tissue is only collected in C section, so only in the OR for moms and babies that are qualified as perfect donors. So, they're healthy, mom and baby, that they've gone through a whole medical history and physical exam, and that they've done virology check. So, that mom is not having any of the most important communicable disease at the moment of birth, right? And
Mm.
also that they've qualified with, there's like 200 different questions that will qualify that person, including mental health problems as a donor of that specific tissue. And that tissue can
Interesting.
be the cord blood, the amniotic membrane, the amniotic fluid, and so it's all that perinatal tissue that can
Interesting.
be donated for eventually a manufacturing facility like mine. That is what I built, a manufacturing facility to be able to conduct clinical trials and specifically drug development of a specific cell, and then the exosomes, the messengers from those stem cells, which are very regenerative, and use those as therapeutic proposal. Like if I'm going to use an Advil for pain and inflammation and edema, right? What are the cascades that it will impact? How what is the dose that I'll use? So that is something that I specialized on with a private company that I made it public and that continues to be a public company, 5 approved INDs, new drug application approvals with FDA to go down the path of drug discovery.
Okay, that is amazing, and I think hopefully our listeners understand what a big deal that is and how hard that
Mhm.
is. I mean, to have a biotech company that, first of all, gets any successful IND is huge. How many years did you work with them to get 5?
So we've our our legs of work before we submitted for the first IND were probably 4 or 5 to be able to secure all the data. And we were
Yep.
working for COPD, so a bronchopulmonary dysplasia model with University of Miami. So it's a lung injury model to understand the destruction of the lung for COPD. And it was that model that was like almost ready for submission when COVID happened.
Wow.
So we were at the perfect time with the perfect amount of data, with the perfect team, with the
Mm.
grit that we had to be able to flip the scenario of COPD to acute respiratory distress syndrome due to COVID, and presented that very early on. I think it was May of 2020. Imagine we were just coming up with like,
Wow.
we are in COVID, the world stopped. We had all this information. Um, Trump was gave the order to FDA, anything that is legit that's coming through the door as a therapeutic, you got to look into it. So there were
Mhm.
specific committees in FDA that were looking at potential therapeutic proposals. And I think the regenerative medicine, serious regenerative medicine companies that enter the space very, very soon, we were lucky enough to work with FDA. Very hard, not easy. Many companies
Mm.
tried
I'm
and
sure.
did not get approval, or had to try a lot of times. But again, my team, being able to secure a team with so much knowledge, being able to understand what it takes from a co-founder, the scientific officer that I was, to have the team ensemble to, you know, work against the time, against the hours, respond to FDA to every single question, and then be able to get the first approval. That was a huge leap. That was like, that's what opened the doors to then be able to submit for the rest, um, INDs in a matter of 3 years that we got
Wow.
all five.
Amazing. So, most of our listeners are going to be physicians who either have been in clinical practice or are still in clinical practice. For
Yeah.
any who might be interested, like listening to this and being like, that's so cool. I would love to work in a company like that. I'm curious, as the chief scientific officer with these kinds of companies, with all the experience you have, what advice do you have to give clinicians who might want to start in a more research space or facilitating the clinical trials of a research company? Like, is there a role for someone who right now might just be seeing patients in the office? And if so, how would they get started with that? What advice would you give them?
Absolutely. I think we have a big gap of knowledgeable individuals that have so much insight on specific fields, and there's so many drug companies that are out there like trying to like find the people that can do this. Maybe you have not looked into that, but doing a consulting specifically for specific trials to review data, to review protocols, to review um, even the team of how the team is assessing a condition. As physicians, we have a way that has been engraved to us of how we see the problems, right? And how to solve it. Even though I'm MD, my PhD was in neurotherapy also, which is funny because you're like, what would a tumor think? I study the parasympathetic and sympathetic nervous system, right? Like it's like, but I think that that gives us more insight on how to resolve problems.
Yeah.
And at the end of the day, we're still going to find our way of how to do it. And I think physicians have that uniqueness, and you should be exploring those things that do not require you to be a full time, and just message biotech companies. I am in the biotech space, so I would say biotech because there's a lot of need for actual physician brains that people are looking for.
Okay, that's great to hear. So even if you don't have experience, a cold outreach to someone on LinkedIn or an email might be very welcome, you're saying, because there's that
Yep,
lack of bridges, I'm sure, between people who work in the scientific biotech side of things. They may not know so many clinicians, but there's definitely complementary thinking processes and skill sets and value that a physician brings to this side of the
brings
table too. Okay, awesome.
absolutely. And more of you are in a specific field, right? There's so
Mhm.
much research happening in specific fields. And if you do consult with several biotechs, then you will have leverage to go to a bigger
Right.
company and say, hey, I've consulted with this companies and I'm ready to go to the next step. And I think everything is in the entrepreneurial world. You cannot expect to be handed a plate or one step to the next to do things. You have to just jump first, head first, and
Yeah.
dive in, and then you'll figure out as you go. And it does. You have to have a specific brain to do that, I guess. But I feel that a lot of doctors are missing out, specifically in this time and age where they're paying doctors less and less. And it's not easy. Like, the economy is not easy for any physicians that are parents that are, like, we've worked so hard. We've educated ourselves for so many years in so much debt to not have the business brain is a disservice. Like,
Mm.
explode that. Like, uh, think as a
It's
chiropractor, with all the respect to my chiropractor friends, but they're great business people.
they
Like,
are.
how are our MDs and DOs not exploiting that side of their brain?
Well, of course, I have thoughts about that as a
Mhm.
psychiatrist and understanding the psychology. I think the types of personalities and minds that are attracted to medicine are the types who really like order and predictability and, like, tell me what to do and I will do it, right? And
Right.
so the whole path, it's insane when you think about the match. Like, what other field would
No.
subject its people, like, a person with an entrepreneurial mindset, excuse me, would never tolerate being part of this process where you have no control. You just open an envelope and figure out where you're gonna be for the next few years of your life, that's, like, not
And the
the type of
pay,
person. And the pay, all of those things, right?
the
So,
sleep.
we are people in general who value predictability and certainty more than potential and risk. Um, and you are absolutely right, but we all have all aspects of this in our potential. We're all pluripotent
Mhm.
in that way, and so I think you're
Correct.
right. It's important to say to people who are comfortable in their MD role where I became this specialist and then I applied to this fellowship and then I got this job. If you've only chugged along that very predictable path and you've never kind of just sent a cold email to someone asking, "Hey, this is what I do. I like what you're doing. Could I help out?" That's gonna feel very foreign to you. That's going
Ab
to be very uncomfortable for most physicians, the suggestion you made. Less so for me now
Absolutely.
because 'cause I've been doing entrepreneurial work for several years, and I don't expect that all those cold messages will return great results, but I know that if I
Mm.
don't send them, then for sure I won't get those opportunities, right? So you just have to get over yourself and try it. And I think
Well,
your path is exactly right. It's gonna be a stepwise process, right? You're probably not gonna land your dream job the first time, but you're gonna meet someone who knows someone else, and then you're gonna step and do different things, and you just never know. So let me ask you this,
absolutely.
given your path, I think we probably
Mhm.
it sounds like we graduated around the same time. I finished med school in 2007. Like, if you
Oh,
were looking
yes,
back at yourself
exactly.
10 years from 10 years ago, like, would you ever have predicted that you would be where you are now with, like, 2 biotech exits and starting a new venture? Like, could you have predicted this journey?
Absolutely not.
Yeah,
I
right?
I've been I am a daughter of a physician that is so passionate and loving, but and even though both my parents are entrepreneurs, and he taught me to dream big. Never in my wildest dreams, as a woman immigrant, woman of color, coming to a field that's so male dominated, first in medicine and second
Mhm.
in biotech, in a field that it's so cutting edge, so brand new, so almost untouched because it's so people are afraid they don't know
Yeah.
where to start, right?
Mhm.
Um, just to think that I I am the brains of both big biotech disruptors, and I'm here for more. um, I think that's something personally that I don't see ever as a limit, but I think we have women specifically and as physicians, like as you were saying, we want to see everything like the way that they told us we're supposed to do, right?
Mhm.
But then we arrive to those positions as a I don't know, you're already you're at the top because at this age, we're, like, kind of, like, already in the top, let's say. And most of these people are like, but why am I not fulfilled? Why did I waste 20 years of my life, of 30 years, including your career time, right? It's like, and you didn't reach a point where you like are so proud of everything that you've accomplished. And I think it's a waste of life, but it's always there's enough time to turn around. There's enough
Yeah.
time to reinvent. There's so much in healthcare that can be improved today with AI. So I just finished AI in healthcare certification from Harvard Medical School, which is like so incredible because healthcare is one of the biggest impacted by AI done
Mhm.
correctly, right? Is like overseeing and the thought process of creating software. It's I'm like, I already I'm
There's
like
so much
ready
potential.
for my so much. And
It's
each and every
crazy.
single one of us in our fields can absolutely think of one or five things that you can automate that you don't
Yes.
have to personally go through. Like I remember like my chief medical officer had to review all of these donor qualifications and he would be like, "Mari, did you review? Are you okay with that?" I'm like, "Yeah, I review, and our quality control team has reviewed, and everything looks to the T." Like, "Oh, great." I'm like, "You're supposed to actually review it." So things like that, stupid little things like that. That what if we have automated procedures for
Yeah.
those? Um, and and that is my field, right? So I'm leading every day in that field. But every single one of you, as physicians, are living in a world that you can think of those softwares to do. Go raise money. Go implement it right now. It's really hot. Like you can make a lot of money on and solving problems, not only to make
Yeah.
the money, but to solve the problems.
I think that's just a big mindset shift for most people who are in employed medical jobs. Um, and I get it because I was there too. Like I was there just a few years ago actually. Like when you're in the trenches and you're seeing patients from 8 a.m. to 5 p.m. or, sometimes way longer, it's very hard when you're in that to step back and realize, oh yeah, of course you're absolutely right. Every physician in practice, if they gave it some thought, would be able to come up with five or a dozen or more ways that they could make what they do every day more efficient using AI tools if they understood what AI is. But again, with that mindset of like, I'm a rule follower, just tell me what to do, what I see is actually a lot of resistance to AI in some
Of course.
medical groups with some physicians and just generally the population. And of course, I don't want to get into the ethics of it and all like the people who are going to lose their jobs, the costs, the water, all of the environmental impact, all of that. It's complex for sure.
Very.
But the other way you can look at it is we have this amazing new tool that's going to make things faster and easier and let us bring more humanity back to the practice of medicine, really. That's what I'm really excited about with AI tools. Not that they're going to replace my job or other people's jobs, but like let them do that part, like you were talking about, of taking all of the data about these patients and figuring out who is the best candidate for the transplant or whatever. That could totally be trained on AI without you as the physician having to spend 3, 4 hours a week going through the charts and making a tabular graph of all of this data to present at your meeting, right? Like that's something that definitely an AI tool could help with. So you're absolutely right. There's so much
Love.
opportunity for people who have
Mhm.
creative minds and an entrepreneurial spirit to take it. But let me ask you, so how did you so you were a co-founder of these companies. How did that happen? You have an entrepreneurial parent, so obviously this wasn't totally out of left field. You had some example in your young life of seeing someone doing novel things, knowing that that was possible. But for
Yeah.
you, like what was the journey like when you started your first company? How did that happen?
Yeah, I think I've started companies since I was very young. I mean, I owned a nutraceutical company with my siblings that my
Nice.
parents kind of like not handed to us, but they said, "This is the gap. We can fulfill it. We're gonna do all of the buying in Germany and the US, and can you guys run it?" At that point, I was probably 16. My
Wow.
brother is 18, 19, and I would work on the summers. It was our pharmacy. It was like a family business, and and always through med school, I worked in my father's clinic. So I would put IVs. So I'm great to canalize veins because of so much experience. Usually doctors don't ever do that. They don't know how to get a vein because the nurses do that, right? But I did all of that all the time because I wanted a little bit of money. You know, we study medicine. We're still dependent on parents paying for it, or you know, it's really really difficult to go through med school, and
Mhm.
yeah, and also I married a businessman, and you know, it was just like the perfect match of where he would handle the business side and I handle the medical scientific side of all of the projects that we started. And when you today, looking backwards after those two mega exits, you know how many things failed? 10,000 failed. And you got to just repurpose, rethink. And that's like our brains that are wired, I guess, differently. It's like you
Mhm.
cannot give up. And as a scientist, you know, you got to fail to adapt and come back and see if that takes. And if not, you adapt and come back and adapt and remodel and remodel and remodel. And eventually it does pay off. Eventually, after so many failures, it does pay off. And yeah, I think that's how my brain works.
No, and I think that's a really important thing. This is something so I'm a child psychiatrist. I build myself as the parent doctor. And one of the 5 pillars that I teach parents is embracing failure. I think it's so
Yeah,
important because again,
so important.
that temperament and personality, which is overrepresented in people who become physicians, because again, you've got that delayed gratification, kind of perfectionism, the desire to always be the best and get the gold star and the A plus, right?
Yep.
That for that person, the ability to embrace failure, what you were just talking about, which is a strength for an entrepreneur, it's kind of
Hmm.
a relative weakness for that person who becomes an MD most of the time. Like that personality has a weak muscle when it comes to being able to celebrate when they fail and viewing it
Hmm.
as the learning opportunity that it is. But I think it's definitely something we all can develop in ourselves. It's just a mindset issue. It's asking yourself instead of telling yourself the story of like, "Oh, I'm horrible. This didn't go well." Instead, saying like, "Okay, that didn't work. How can I do it better?" And knowing that there's always, so long as you don't give up, room for improvement. And each time you try, it's more likely to succeed. So you should be excited to keep trying and keep failing because it's just going to make you better. I think that it sounds like from your family experience, based on your entrepreneurial family, that was kind of ingrained in you. And then you attracted a mate who has that same kind of business mindset, which is it's part of that too, right? So that's key. I think that's really important. And I think not having that as a strong, psychological muscle is part of what holds people back from taking
Yeah.
the leap from what they know as a W-2 employee, as a physician who's at the top of their game, to trying something new because you will fail if you try something new. You're not going to be as good at the new thing as you are at what you've been doing for 20 years. But
Correct.
when you shift to seeing that as something beautiful and exciting rather than something negative and to be avoided, I think really amazing things can happen.
Yeah, I
Well,
love
I don't
that
know what
that's one of your
direction.
pillars. So
Yes, well,
I think
it's so
society needs
vital.
more. It's so
It's
important.
really vital. And it's really vital too to, I think to where we are, I don't wanna get on my soapbox, but, like, as a country, we're so polarized. I mean, I think when it comes to communication and understanding people with different opinions, it's part of that too, right? It's embracing that, like, when you have a connection with someone, sometimes you're gonna offend them or they're gonna offend you, and that's part of the journey of, like, understanding each other better. Is failing in the relationship too, but we've gotten all fragile about that as well.
Yeah.
Um,
So we can have the difficult conversations when the difficult
yeah.
conversations is what where it's at.
Right, we have to have, like, trigger warnings on everything. It's like, no, that's just life. Like, life is a trigger warning. Like, you're alive, you're gonna be hurt, like, that's part of it. Um,
Yeah.
well, so I don't know what direction I wanna take this. Let's talk about what you're doing now with women's health, and you said you wanna be disruptive AF. So, like, tell me what's your vision for, like, the next 5, 10 years? What are you gonna do?
Yeah, so just the fact that women were not included in research until 1993 is like surreal to me. I feel like
It's
now
insane.
as it's insane. The fact that tampons were used with blood just recently after Barbie movie was released should be a big alarm. They did not use blood with tampons until recently.
What do you mean? Like to test them?
Correct.
Or
They use
what?
dyed
Oh, they use the
water.
blue liquid, like on
Correct.
the commercials.
And that is a male behind those industries, right? Like all of these things that are wait, BMI. BMI was tested on European white males.
Right.
So I'm a Latina. Like, go through my picture. I'm a full blown Latina. BMI is like I'm
Does not apply.
extremely
Yeah.
obese, right? And it was not recently when they are like, oh, BMI is not an indicator. Yeah, hell yeah, it's not an indicator because it was not the sign for the rest of the population.
Yeah.
So, like, stupid little thing like that have like geared women's health into the worst conditions. So
Mm.
I am so fortunate to be surrounded by a lot of physicians that are in the women health space. And, perimenopause menopause is, even though it's a hot topic, it is a topic that needs to be screamed out of the every single rooftop because we don't deserve to live with brain fog, with us having anxiety, the most amount of divorces and suicides, and leaving companies and your after you've worked so hard for so many years have to leave that because you think you're going crazy. It's not okay. It is definitely not okay. We have to shift that, and I think it's up to our generation to shift that, right? Endometriosis. Like I'm so again grateful that I have so many physician friends that are so knowledgeable in so many things that I was able to pick up on my daughter's endometriosis signs so early that
Oh,
I
wow.
brought my
You're lucky.
pediatrician into it, and she was like, "Okay, let's look into this." It passed 1 year until I was like, "You know what, guys?" I got the pediatrician, the adolescent medicine doc, and then the OBG that was going to do the surgery. And they kept delaying until a point where I said, that I cannot see my daughter just she could not do it 1 week
Mm.
out of the month with so much pain, uh, with her relationship with her periods being so dramatic and so bad. I was like, "I this is not okay," until I had to fly out of state to ensure that I was with the best, excision surgeon in New York. Grateful Dr. Lou for everything she's done, but it was not until the pathology report came back when I was able to actually breathe and say, she was not making it up. She was really in
Mm.
a lot of pain. 7 out
Mhm.
of those excisions that they took came back positive with endometriosis. So imagine that endometriosis is not diagnosed in 7 to 10 years, that women have to go through that
Yeah.
pain where doctors say, nothing came back in your sonogram. Of course, it didn't come back because nobody
Right.
has looked into it. I feel like now women are pushing into research into all of those things, and like that PCOS that now is PMOS, right? Like we are breaking the barriers. We are working towards women's health, and I feel like regenerative medicine has a lot of potential to help the inflammatory side of a lot of problems for women. Women are the nervous system is just the amount of receptors in the nervous system is why we feel more pain and we are more like
Oh.
aware of it, which is beautiful to understand like the biology of it. So if we were not included in those research, of course, hysteria, hyster being the uterus, was a term that was like medically used until recent,
Yeah.
the 70 in the 80s. Like, what the actual hell? Like, no way. If you talk to so many OBG doctors, friends of mine, they said, well, the doctors in the background would say, oh, here comes the middle aged woman. Noted that she's going to be crazy. Of course, we're going crazy. Estrogen and progesterone went to the hell. Like,
Mhm.
what do you expect? Biologically, we're going to go crazy. We don't know what's happening. We're in rage, brain fog. We forgot about everything. Husband is chewing Cheerios, and you're like, What are you doing?
Oh, you're speaking my love language, Mari. Yeah, no, definitely. Amen to everything you just said. I'm definitely in the thick of all of that perimenopause stuff. I'm now on hormones and I feel so much better just in the last 3 months. But yes, exactly. I love that there's at least comic relief. At least it's not something I'm going through alone. I'm grateful
Mhm.
that there's more discussion and community and social media
Yep.
reels to make me laugh until I cry. Just like all this relatability that women are talking about this phase of life that isn't a permanent phase of life, but is a phase of
Yeah.
life that um, is definitely really challenging for many of us, at least, and
For all
and
of us,
and
it requires
confusing.
optimization.
It
It's
requires
nothing like
optimization, but it's a murky optimization. Like, even for people who specialize in menopause hormone treatment, like, 'cause I see these doctors, and it's a little bit of this and a little bit of that, and you try your best, It's very much like psychiatry, actually. So I get it. It doesn't mean it's
Mhm,
less real, but for
mhm.
people who have that mindset of, like, well, there's nothing there, you're fine. Or, that's the kind of surgeon's mindset of like, this is not something physical. It must be in your head. like, um, it's not that. It's real, but it's just harder to figure out. And
Yeah.
I love that
It
you're
requires
promoting
personalized
research.
medicine.
Yes, which is the direction we're going for so many things, whether we're talking
Yep.
about differences in race, like you were talking about,
Yep.
differences in gender, we're all unique individuals, right? And
We
so
are.
it is one size fits most, but not one size fits all. It never has been, it never will be. And I think the
Mhm.
nice thing about the future of medicine is we are heading to that direction of being able to have more personalized care, which is beautiful. And I think it's a really
Hallelujah.
exciting time to be a physician, actually, for that
Yeah.
reason. Um,
Yes, yes.
of course, insurance-based care is always gonna lag, and it's not gonna be individualized care for a long time, but it's available, and that's what's important,
Mhm.
and it sounds like
Yep.
regenerative medicine is kind of the same. It's an option that people can choose, and it's
Yeah.
effective, and it's safe, but it's not the thing that you're gonna bill your Medicare for, probably. It's something that you're gonna decide to
Not
take
yet.
advantage of.
Un
Mhm.
Unfortunately, not yet, but as I was saying, Florida is the first state to fully approve stem cell, treatments for pain, orthopedic, and wound healing done by a licensed physicians manufacturer in a facility that follows all FDA, and AATB regulations. So it's like there are
Amazing.
rules,
So it's
there
coming.
are ways.
Mhm.
It is here. Like, it's not the
Yeah.
future anymore. You don't need to go to Panama, Costa Rica, Mexico, and get those stem cell treatments. You can come to Florida now. So,
And is that where
um,
you're based? Are you in Florida?
I am based in Florida,
Very
yes.
nice.
Yes.
Nice. Awesome.
But I think more and more states are going to roll into the regenerative therapy the same way as more and more physicians are understanding that there is another way to treat perimenopause and menopause. A lot of
Yeah.
physicians understanding of the power of lifestyle medicine that impacts everything, right? In any of their specialties or subspecialties. If there's no lifestyle medicine, what are we actually doing? So
Yeah.
that's why I'm a loudmouth.
I love what you're saying. I love that you're a loudmouth. I think what you're doing is beautiful. Thank you so much for being on Super Duck Stories. I will make sure that your website and contact information and social handles are in our description. And if anyone wants to reach out to you, are they welcome to do that?
Please DM me, send me an email. Yeah, I'm always available to coach anybody. I'm honestly like that open. I'm not selling anything. I just want to. I'm here for the greater good.
Thank you so much, Mari. It was great to talk to you.
Same. Thank you.